The rise of drug use among teenagers is more than just a statistical concern. It's a growing crisis affecting countless families and communities. According to the CDC, around 15% of teens have used illicit drugs at least once before graduating high school. What's alarming is that the substances and ways they are accessed have evolved, making traditional prevention methods less effective. So how can parents, educators, and community leaders adapt to protect today's teens? The answer lies in new, research-backed strategies that prioritize connection, education, and holistic support. Foster genuine connections, not just conversations. Research consistently shows that teens who have strong, supportive relationships with adults are significantly less likely to engage in risky behaviors, including drug use. Here's how to nurture these connections. Be present. Show genuine interest in your teen's daily life. Listen actively, ask open-ended questions, and validate their feelings. The goal is to create an environment where they feel safe to express vulnerabilities without fear of judgment. Encourage mentorship programs. Facilitate opportunities for teens to connect with positive role models, such as local professionals, college students, or community leaders. Mentorship builds confidence and offers an alternative vision of success, reinforcing healthy choices. Integrate emotional intelligence, EQ training in schools. Teens who can identify and manage their emotions are less likely to turn to drugs as a coping mechanism. Integrating emotional intelligence, EQ programs into school curriculums can play a transformative role in drug prevention. Self-awareness workshops. Introduce workshops that focus on recognizing emotions, stress management, and building resilience. These workshops empower teens to understand their triggers and develop healthy coping mechanisms. Peer-mediated support groups. Encourage peer-led support groups where teens can openly discuss their challenges and receive guidance from trained facilitators. Creating a judgment-free space is essential for destigmatizing conversations about mental health and substance use. Leverage digital tools for real-time intervention. The digital era brings new challenges, but it also offers innovative solutions to prevent drug use among teens. With over 95% of teens having access to smartphones, tech can be a powerful ally in prevention efforts. AI-powered apps for mental health. Apps like Woebot and Headspace use AI to help users manage stress, anxiety, and depression, common precursors to drug use. Encouraging teens to use these apps can provide immediate support, especially when they're feeling isolated. Social media monitoring with consent. Platforms like Bark and Custodio allow parents to monitor social media activity for warning signs of drug-related content. Always approach monitoring with transparency and consent, making it clear that safety is the primary goal. Normalize open dialogue about drug risks. Teens are bombarded with mixed messages about drugs, whether through media, peers, or pop culture. To combat misinformation, we must create a culture of transparency and open dialogue. Host interactive drug education sessions. Move away from traditional fear-based drug education. Instead, use interactive, evidence-based workshops that focus on the science of addiction and its impact on mental and physical health. Real stories from recovering teens can make these sessions more relatable and impactful. Use harm reduction language. Adopting a harm reduction approach doesn't condone drug use, but acknowledges that some teens might experiment. Teaching safer practices while emphasizing the risks can prevent tragedies like overdoses or accidental drug mixing. Create positive alternatives for risk-taking behaviors. Teenagers are naturally wired for risk-taking, driven by neurological changes in the brain. Instead of simply restricting risky behaviors, provide structured, positive alternatives. Adventure-based programs. Encourage participation in adventure sports, martial arts, or performing arts, which fulfill the need for adrenaline while promoting physical fitness and mental discipline. Entrepreneurship initiatives. Programs like the Young Entrepreneurs Academy channel teens' energy toward creating and managing business ideas, providing a productive outlet for their creativity and drive. Build stronger community networks. Preventing drug use among teens isn't just the responsibility of parents or schools. It requires a coordinated, community-wide effort. Community coalition building. form local coalitions that involve parents, teachers, healthcare professionals, law enforcement, and youth organizations. These coalitions can identify local trends, share resources, and support at-risk youth. Host drug-free community events like movie nights, cleanup campaigns, or music festivals that promote drug-free environments can make a significant impact. These events reinforce the message that having fun doesn't require substances. Strengthen mental health support systems. Untreated mental health issues often pave the way for substance use among teens. A study from the National Institute on Drug Abuse found that 60% of teens with substance use disorders also have a co-occurring mental health condition. Addressing mental health early can significantly reduce drug use rates. Increase access to school counselors. Advocate for more counselors in schools to ensure timely, professional support for students experiencing emotional distress. Teletherapy options. Provide free or low-cost access to teletherapy services, allowing teens to receive therapy from the comfort of their homes. This minimizes barriers to access, such as transportation or stigma. Equip parents with modern tools and knowledge. Parents remain one of the most influential factors in a teen's choices. Equipping them with the right tools and knowledge is essential. Parental workshops. Organize workshops that educate parents on the latest trends in teen drug use, such as the rise of vaping, prescription drug abuse, and synthetic drugs like spice and bath salts. Understanding the current landscape empowers parents to have more relevant discussions with their teens. Encourage digital literacy. Teach parents how to use parental controls effectively, understand social media trends, and spot early warning signs of substance use. Conclusion: a call to action for collective prevention. Preventing drug use among teens is not a one-time conversation or a single event. It's an ongoing effort that requires innovation, empathy, and community collaboration. The strategies mentioned above emphasize connection over control, education over fear, and empowerment over punishment. By shifting our approach and working together, we can build a safer, healthier future for our teens. Let's take action today for a drug-free tomorrow. If you found this video insightful, consider sharing it with parents, educators, and community leaders in your network. Together, we can make a difference. Have strategies that have worked in your community? Share them in the comments below. For help, call the SAMHSA hotline, 1-800-662-HELP. Brought to you by Kenneth Thomas, CEO of Visionary Tide Media.